Hello, my name is Gretchen Schanfeld. I'm the Director of Health and Wellness at Nationality Service Center in Philadelphia and also the coordinator for the Philadelphia Refugee Health Collaborative. Welcome to this second part of a series of three entitled Refugee 101. This session talks about working with refugees and limited English proficient populations and can be a helpful primer as you prepare to work with these groups. So today we're going to review a little bit what was covered in Webinar 1. If you haven't heard Webinar 101, I invite you to go back and listen to that first. But we'll review a little bit of the information there and then talk a little bit about some of the barriers and how you can support refugees in overcoming these barriers. As was mentioned in the first webinar, about 70,000 refugees arrive to the U.S. on an annual basis, with about 800 coming to the Philadelphia region. These individuals are supported by 3 local agencies listed here that provide initial supportive services to help refugees get set up here in the United States. Additionally, there are a number of other unique programs and services here in the Philadelphia region, and I invite you to continue on to Webinar 3, which talks a little bit more in depth about these various programs and services and how you can refer to these services. Of the 800 refugees arriving to Philadelphia, they come from a diverse backgrounds and countries throughout the United States. These include Iraqi and Sudanese refugees, primarily Arabic speakers in Northeast Philadelphia, as well as a small but growing population from the Democratic Republic of Congo in Northeast Philadelphia. Additionally, in South Philadelphia, there are large numbers of Bhutanese and Burmese refugees, and a small but growing number of Congolese refugees in the Point Breeze section of Philadelphia. Additionally, there is a small Eritrean community in Southwest Philadelphia, as well as a number of other smaller communities from countries around the world, including Afghanistan, Central African Republic, and others. If you're interested in finding out more about the individual populations, we're not going to cover that today, but I would invite you to check out this philarefugeehealth.org under the provider section, where you can find in-depth refugee backgrounds for each of these populations. So a quick refresher on some of the rights of refugees in the United States. As we discussed in the first webinar, refugees are humanitarian immigrants and therefore have the right to be enrolled in public assistance programs, including Medicaid, directly upon arrival. Refugees are also eligible to work immediately upon arrival, and employment is a key priority of the U.S. Refugee Resettlement Program. And refugees are on a path to citizenship. So after 1 year, they can apply for a permanent residence card or green card, and after 5 years, their citizenship. So what are some of the barriers that refugees face when they arrive here in the United States? As you can imagine, there are many challenges alongside many opportunities with this population. And these are just some of the barriers that are faced by refugees. Language, lack of context, trouble navigating systems, and health issues. Today we're going to talk about language and navigating systems. I invite you to stay tuned for additional information on clinical and health issues related to refugee populations that should come out later this year. So let's talk about language. The diversity of refugees arriving to Philadelphia includes a large diversity of people's linguistic backgrounds. So clients speak many different languages, and we have a large continuum of clients, including those who may be fluent in English and have a large amount of formal education in the English language, to those who may have never had an opportunity to learn any English, and even those who may have had limited opportunity to learn their own language or be literate in terms of in terms of reading and writing their own language. What this means is that we will likely, in our interaction with this population, have the opportunity to work with interpretation and translation services in order to provide needed services to these clients. We call that language access. The federal law governing language access is called Title VI of the Civil Rights Act. This was federal legislation that prevented discrimination based on a number of categories, one of which is national origin. Since then, national origin has been interpreted to mean language. And so this legislation and subsequent interpretations have said that all agencies that receive federal funding must provide language and services to ensure that clients have equal access. So what this means, if your agency receives any type of federal funding from Medicaid, Medicare, federal grants, you must provide equal access to services. And you can do that in one or many of a number of ways. You can and should provide notices for limited English proficient clients that you do have interpretation services available. You could hire culturally competent bilingual staff. You can provide telephonic or in-person interpretation services. And for large minority languages, you may be required to provide written materials in a language that's comfortable for the client. If you're interested in learning more about your individual's agency policy, I encourage you to speak with your administrator, who should be able to provide you information on your language access policy. If you're interested more generally, this LEP.gov is a great resource. So on a practical level, we know that we're required to provide equal access through interpretation services, but on a practical level, what does that mean for us? We've compiled a few brief tips on working with an interpreter. As you can imagine, this is like a skill, like any other skill. It gets easier and faster with time. So some tips. When you're working with an interpreter, you can speak just as you would in a normal conversation. For example, do you have a fever versus interpreter, can you please ask the patient if she has a fever? You can also position the conversation just as you would a normal conversation. So it's important to think about where the interpreter or where the phone is sitting between you and the patient so that you can still maintain eye contact, read body language, etc. You can introduce yourself to the to the LEP client, as well as ask the interpreter to introduce themselves. Once you've started the conversation, it's important to remember to speak in short sentences or short thoughts to give the interpreter enough time to interpret. It can also be helpful to remind clients to do the same. Sometimes when clients get excited or have a lot to say, there may be challenges, and you may need to remind the individual to pause as well, because you also need the help of the interpreter to understand what they're explaining to you. And finally, we recommend that you use the teach-back method to ensure that the patient or client understands what you want to communicate. So rather than asking yes or no questions like, do you understand, ask the patient or client to explain back to you when they're coming for their follow-up appointment or how they're going to plan to take their medication. If you're interested in additional resources on guidelines on using an interpreter on language access policy, we've compiled a number of resources here, so I would invite you to check out any of those. Those include guidance from the American Medical Association, from refugee health providers, as well as scripts for using an interpreter through the Refugee Health Technical Assistance Center. Next, the second challenge that we're going to address today is navigating systems. As you can imagine, coming from the various contexts that our refugee clients and patients are coming from, there is a lot to learn here in the U.S. and a lot of various systems that they may need to navigate, including how to communicate with an employer, how to interact with needed benefits or services, and even how to engage with their child's school. Among the most complicated of these is our very complex health system and health insurance. And so we wanted to recognize that and also provide you some tips on how you can support patients in navigating systems. So in understanding this challenge of navigating systems, I think it's important to recognize really from the client perspective what these processes look like. This diagram explains the process for renewing a public benefit application. So as you can see, one might first complete the application or the renewal. They may be asked to provide supporting documentation. They may be asked to travel somewhere to turn that in, to wait for a response. They may have to appeal, and they may actually be denied the benefits or need to go redo the application or things of that nature. As you can imagine, this is a very complex process and may be confusing to clients who are trying to navigate these systems for the first time. So there are a few helpful tips that you might want to keep in mind as you help clients in navigating systems. The first is to explain the big picture. What does this mean? For example, a pre-authorization that's needed for a particular medical test. This involves interaction with multiple systems. It involves with the referring doctor's office, with the insurance company, and where the test will actually be completed. So explaining to the client that why you're recommending this test, as you would with any patient, as well as what the process will look like for getting the pre-authorization and what they should do at various steps. So really taking a step back and looking at the big picture. It's also important within this process to manage expectations. How long will it take? What can the individual expect as an outcome? What if this test isn't approved? What will happen then? So really thinking through with the patient what the process will look like. We also encourage you to connect with available supportive services, whether that's a clinic liaison, a resettlement staff member, or another available supportive service. There are many services and programs available to support this community here in Philadelphia. And I'll use this to plug Webinar 3, which will talk a little bit more about those various programs and services, but I encourage you to engage with those on behalf of your clients. Finally, we just wanted to touch a little bit today on culture because, as you can imagine, in addition to language and some of the other challenges that refugees face when they arrive, culture shock and kind of acclimating to a new culture is one of the major challenges as well. Within this, I think it's important, we often talk about in various settings the idea of cultural competency. And today we're going to talk more about cultural humility as a concept that we can use because we have such a diverse group of individuals. It may be hard to be competent in each individual culture that we're working with. But instead, we can learn a little bit more about cultural context overall and the components that make that up, and then talk a little bit about cultural humility. So let's first talk a little bit about what makes up culture. As we can imagine, each of us has a particular set of values, attitudes, ideas, behaviors, and practices that really influence how we interact with the world and how we interact with each other. This is also true for refugee clients. So everything from gender roles, generational roles, may influence how they interact with the world. As we've said, it may be very difficult to become an expert at many of the different cultures that we're interacting with. In a given day, you may be working with refugee patients from a number of different cultures. And so we like to teach this idea of cultural humility as a way to interact with this concept. So cultural humility is really the idea of an open stance where you are open to relating to individuals from a different culture and recognizing that all of those different cultures have value. So how do you do that? First, you need to understand and recognize that you have your own culture, your own thoughts, feelings, and judgments that influence how you interact with the world. The second step is recognizing that all other perspectives have value, that yours is not necessarily the right way, but that a client or a patient may have a different way of looking that has equal value to yours. And then the final step is proactively creating and participating in diverse cultural experiences. Now, this doesn't mean that you need to go to a refugee community event every weekend in order to engage, but these can be very small and subtle moments where you have the opportunity to engage with your client or patient about their culture and what's meaningful to them. Asking the patient to guide you through the process about what's comfortable them, asking the patient what what has worked particularly well for them in the past. Things of that nature could all lead to these moments of participating in diverse cultural experiences. This slide talks a little bit more about the self-reflection piece, and so I'll cover it briefly because, as I've mentioned on the last slide, it is really the key starting place for this. So recognizing your own cultural and family beliefs, are you aware of your personal biases and assumptions, and really challenging yourself to that maybe your values aren't the norm, and putting yourself in someone else's shoes so putting yourself in someone else's shoes by describing, for example, a time when you became aware of being different from other people. So really taking that other-oriented stance is the key tenet to developing cultural humility. I'd like to end this second session with some suggested reading or viewing that can help give a little more perspective on some of these barriers that we've talked about today, and provide a little bit different perspective on these issues. These include the one I'll recommend the most is The Spirit Catches You and You Fall Down. Is a great book which really shows, in essence, the failure of cultural competency and cultural humility in a medical setting, and may provide us some lessons learned about how to go forward. So with that, the second session will end, and I invite you to participate in the third session on resources for refugees. Thank you.